I'm gonna talk about care plan, and these are the care plans that I want to tell you. It's regarding abruptio placenta. So, regarding abruptio placenta, what you need to know is that it means that there's a premature separation of normally implanted placenta from the uterine wall. And this condition usually occurs after 20 weeks of pregnancy but may occur as a late during the first and second stage labor. Its most common is multigravidas, usually in about age 35 or older. And it's usually cause of bleeding during the second half of pregnancy. So just remember, abruptio placenta is classified according to the amount of placental separation and maternal symptoms. Classification is also correlated with fetal symptoms. Classes range from asymptomatic, only recognized after delivery, to 3 or severe medical emergency, usually resulting in fetal death. So the pathophysiology is the primary cause of this abruptio placenta is unknown, but the physical mechanism follows as a characteristic pattern. The blood vessel at the placenta bed is spontaneously ruptured during the lack of resiliency of the abnormal chains to the seal of the torn vessel. And the hypertension complicated the situation as blood entered the muscle fiber. Complete relaxation of the uterus become impossible and increasingly uterine tone irritability. If bleeding continues unchecked, the placenta may be partially or completely shredded off. Accumulation of this blood may be prevent delivery of the placenta. So the possible complications are maternal mortality, vascular or postpartum vascular spasm, could be hemorrhage in the intravascular clotting. There could be a renal failure from the shock or fetal mortality. Neonatal complication could happen too. So we have to do assessment on that. So the nursing history by function, we have to do ask for the nursing history, like did the patient smoke, or is there any substance abuse? Is there any abdominal trauma? We also have to consider the activity and exercise, like uh, activities the patient doing exercises, or like we have to also consider if there's hypertension or gestational hypertension. We also have to check for the cognition and perception. Is there a marked pain, uterine pain, or back pain? Check for the self-perception and concept. So, uh, like anxiety, helplessness, fear, apprehension, guilt. Is there any sexuality reproduction, like we have to consider for bleeding, uterine contraction, placental abruptio placenta. Is there any physical? So we have to do the physical examination, and usually we'll see them with pallor, diaphoresis. Most of the time, their mental status and behavior, they will have anxiety and facial expression of pain. Intergumentary, because their skin could be moist and cold. The ear, eye, nose, and throat, we have to examine that too. And most of the time, their mucous membrane are dry. Respiratory, most of the time, they're tachypnea, increased swallowing respiratory. So when we check their cardiovascular, the tachycardia, hypotension, syncope, cyanosis, most of the time is expected. Gastrointestinal, there should be abdominal tenderness to touch. Neurological, most of the time they will have vertigo and confusion. Renal and urinary, most of the time they will have proteinuria and oliguria or anuria. Reproductive, so there will be a uterine tension ranging from absent minimal board like, there will be a bleeding, ranging from a normal scan to profuse dark red. There could be an increased uterine size, increased uterine tone. There will be a high engaged presenting fart. So most of the time, the nursing care plan, nursing diagnosis will be deficient fluid volume or fluid volume deficit related to bleeding. So nursing priorities these are observed and for prevent promptly. Uh, okay, probably.